Good. Good afternoon. My name is Teun Bousema, and I'll present some very basic epidemiology work. Because that's basically what I do, very basic epidemiology. Nothing very funky. We are doing more biologically interesting stuff, but I'm going to present some very relevant data on infectiousness and how you can detect infectiousness. So Chris mentioned, my graphics are better than Chris' graphics, I think, slightly. Mentioned all the factors related to transmission with the human. You have the demographics, how many adults, how many children are there in a population, their attractiveness, their availability to mosquitoes, are they under a net or are they outdoors? Immunity, that is very interesting, but I will not talk about it today. Then from the mosquito factor side, of course, it's just the abundance of mosquitoes, blood preference, their permissiveness, and for gametocytes, their density, maturity, and sex ratio. And I'm going to touch upon all of the yellow indicated elements. It's almost a sin to show a life cycle during meetings like this, but this life cycle shows the different densities. Could have shown an iceberg. We've seen so many icebergs during this meeting, I didn't show icebergs. But it's important to know these are asexual parasite densities, and we detect many by microscopy, but we know that actually we also miss a lot by microscopy. That's exaggerated in gametocytes, where actually the densities are much lower, typically less than 1% of the total parasite population. So actually it's very difficult to find all gametocytes. Submicroscopic parasite densities, submicroscopic gametocyte densities, and so far we do not have a really good marker of infectiousness, and we don't have a well-established lower threshold for infectiousness. This just means that you cannot predict infectivity based on what you can see in the blood. Luckily, there are experts, and we call them anophelines, and they're very good in finding gametocytes. So in xenodiagnostic surveys, we forget about the diagnostics, at least we forget about it to start with, and we allow mosquitoes to feed on blood of randomly selected individuals. We use membrane feeding assays. We also are going to use skin feeding assays to compare them with membrane feeding assays. With membrane feeding assays, you typically take 2-3 milliliters of blood, you add it to a glass feeder, you allow mosquitoes to take a blood meal, and 7 days later, 6 to 8 days later, you dissect these mosquitoes and you aim to identify parasite developmental stages, oocysts on the mosquito midgut wall. We did this with 200 randomly selected individuals per season per site. Work still in progress. We only used Anopheles gambiae SS mosquitoes, and we used microscopy, although we do molecular characterization of all the oocysts that we find. And after that, we actually look for diagnostics of infectivity. We have microscopy, 200 fields. We look for gametocytes, asexual parasites. We also use both DNA-based PCR and RNA-based PCR. And this is some really good work from our colleague Ingrid Velger from Papua New Guinea, 70 naturally infected individuals with different parasite densities. In dark blue, the ones that were detected by microscopy. In light blue, the ones that were detected by qPCR, DNA-based. And in gray, the ones detected by RNA-based methods. So actually here, half of the infections were detected by RNA-based methods, but not by PCR. So that's the reason to also look for RNA-based methods, and we use 18S for all parasites and PFS25 for gametocytes. So we aimed to do these surveys in 3 settings that it's impossible to capture all of Africa, but at least are representative of different settings in Africa. Burkina Faso, high endemicity, very intense transmission. However, I'm going to show the findings from the lowest of the low season, the dry season, several months into the dry season. Mbita, Kenya, on the shores of Lake Victoria, moderate, perennial, and Kilifi used to be a lot higher, but now it's actually a low endemic site. And this is work in progress. We haven't done all the molecular work yet, but in blue is the parasite prevalence, as Chris said, peaking in the school-age children. But if you do a DNA-based method, you see quite a lot of infections being added to that, and RNA also adds a few more. For beta, we haven't done the PCR yet, but actually this is moderate transmission intensity, actually pretty high, and in califi it's quite low. And you see that actually, and this nicely confirms previous work by Lucy O'Kell, that these submicroscopic infections, as you would expect, are most prevalent in the older age groups, especially in the low endemic setting. So this is the asexual parasite carriage. Gametocyte carriage by microscopy is a lot lower in the blue bars. Actually, by RNA-based methods, and we've only done it for Burkina Faso, it's almost the same. Especially in children, it means that everybody who has asexual parasites also has low levels of gametocytes. But this is just detecting parasites, and I said before, this is not very informative. So what about infectivity? So again, this is in the driest of the dry season. In Burkina Faso, 5.6% of our 198 individuals infected at least one mosquito. In beta, it was roughly similar. And in califi, it was perhaps surprising, perhaps not, it was highest. So 15% of randomly infected, selected individuals, not selected based on parasites by any diagnostic, was able to infect at least one mosquito. And you see a very clear, we see some evidence of an age pattern in the high endemic setting, but actually in the low endemic setting in califi, all ages seem to be capable of infecting mosquitoes. This is the age pattern. What's actually very interesting from a public health point of view, can you detect them? And this is these are all the infectious individuals in the pie chart. In blue, the ones that are gametocyte positive by microscopy. In red, the proportion that is asexual parasite positive by microscopy. So you would have picked them up with a standard RDT or microscopy survey. And in gray are all the ones that are free of parasites by microscopy. So in Burkina Faso and in beta, actually, there is a contribution of submicroscopic infections to infectivity. In califi, actually, the majority of infectious individuals is completely parasite-free by microscopy. But of course, this is just, are you able to infect at least one mosquito? And of course, density matters, and I'll come to that later. But this is just to give you an idea of the proportion of infected mosquitoes. So if you have gametocytes by microscopy, then more than half of these gametocyte carriers by microscopy infected at least one mosquito. So they are most likely to be infectious. However, you do miss a proportion of individuals who infect mosquitoes. And PFS 25 QT NASPA was actually the most sensitive one, the most sensitive diagnostic to pick up everyone who is capable of infecting one mosquito. But you may remember from the previous slide that about 40% of the individuals was actually gametocyte carrier by PFS 25 NASPA, and you see here it's actually only 6% of the total population infected. So it's not a very predictive marker. And the skeptics will say, what about this one, PFS 25 negative, but infectious? Well, this was a P. malariae infection, and we still have to do the genotyping on the oocyst, but it's quite plausible that we just identified an oocyst from P. malariae, not falciparum. So subpatent infections, they do contribute to infectivity in all sites. And interestingly, in califi and in Burkina Faso, some nested PCR negative individuals actually transmitted their infection. So this is the density. So what proportion, if you would have all the infected mosquitoes, what proportion of these mosquitoes was actually identified by microscopy, gametocytes only, or gametocytes and asexual parasites, or microscopy at least having asexual parasites? And this shows a different picture. So the ones that are most, the ones that are infecting most mosquitoes are actually more likely to be detected by microscopy. Still, you miss about 20% of the infected mosquitoes that somehow get their infection from individuals that you would not have picked up by microscopy. And this is in Burkina Faso, but actually in califi, the contribution of submicroscopic parasite carriage to transmission is a lot more substantial. And also in the high transmission season, what we've seen so far, we're currently doing the high transmission season survey in Burkina Faso. There is this evidence that many gamete-site negative individuals and parasite negative individuals by microscopy infect mosquitoes. So this is all nice, but it's a bit artificial. So all these individuals artificially are exposed to 60 mosquito bites on a single day, and of course that's, even in Burkina Faso, that's not very likely. So membrane feeding assays can actually be used to show the potential infectiousness, but they have shortcomings in actually estimating what is the plausible infectiousness of this individual at a given time point. So to get a better grip on that, we in Burkina Faso we selected 30 households and we sampled blood-fed mosquitoes until we had 40 fully fed mosquitoes per household, or until we had spent 2 weeks in that household finding mosquitoes, and we said it's enough. And we also collected filter paper and microtainer blood samples from household occupants, and we linked blood meals in humans and mosquitoes using short tandem repeat loci. So it's basically find out who your father is, kid. The interesting thing is actually we got questions from the ethics committee, not so much about finding out that one of the children was not a child of the parents, but finding a blood meal in a mosquito from someone who should not have been in that sleeping room. Of course, we didn't look for those patterns. What we did do, so this is from the first 15 households, this is the age distribution. So actually in those households we had a very large group of children 5 to 15 years, and about a third of the individuals was adults, young adults, 15 years and above. So this is a household, a mother with 3 children. In this household we caught 22 mosquitoes, and actually 13 of these mosquitoes we could link to the mother and the others to the children. But actually the youngest child, who was always under a bed net as soon as the mosquitoes came out, was not bitten by mosquitoes. At least we couldn't find evidence for it. And if we do that for all the households we've done so far, we see actually, perhaps not so surprisingly, that 55% of all blood-fed mosquitoes actually took their blood meal from an adult. So this means that actually the mosquitoes, they do sample adults and the older children much more frequently than the young children. So some conclusions, as we have known before, for a while, gamete-site prevalence by microscopy has a low sensitivity to detect infectivity. However, the proportion of infected mosquitoes is highest in microscopic gamete-site carriers. If you want to look for highly infectious individuals, microscopy is a very good tool. If you want to use it for epidemiological assessments, it's pretty useless. Submicroscopic infections contribute to transmission in all settings, and our first round of surveys suggests that especially in low endemic settings, they seem to contribute a lot. PFS25 QT NASPA is very sensitive to pick up infectious individuals, but has a very low predictive value, positive predictive value at high endemicity. So there are many people who have gamete-sites, but they're not infectious. So better understanding the threshold density of gamete-sites to result in onward transmission, or better markers of truly infectious gamete-sites would be extremely valuable. And mosquito exposure is a very important determinant of transmission potential. And this is just a graphic where you have the population size in our village. We had only 15% of that village was under 5, and about 35% was 5 to 15, and the rest were adults. So adults comprise the largest proportion of the population. Microscopy gamete-site carriage actually was most prevalent in the young children, and young children really, almost all of them had gamete-sites by NASPA. However, they were not heavily exposed to mosquitoes. So if you would do a very simple calculation, and we're going to do more sophisticated calculations later, here we would estimate that actually about half of all transmission is actually caused by these school-age children, and adults and young children are equally important if you take into account mosquito exposure. So I'll leave it at that, but not before I acknowledge the people we are working with, and especially the entomology and clinical teams in Burkina Faso, CNRFP, Isipe, Kenya, and Camry Wellcome Trust. Thank you very much.
Thanks, Teun. We'll take a couple of questions for clarification if someone has them, please. Yep, there's one there.
Hi, I'm Ann Stewart from Uniformed Services University, and the other day we gathered in here to honor Bill Collins, and I need to channel him for just a second right now, because one of the microscopy is not always microscopy, and I think there's no question in any of our minds that to do good epi these days you have to be using molecular tools, whether it's the NASBA or PCR or the large volume PCR or whatever it is. But just so, one of the cool things about those old generation of malariologists is they really understood their systems really well. And when you do a thick film, 90% of the gametocytes are lost. So one of the things Bill Collins taught me was that if you want to do gametocyte counts, you have to do 1,000 thin film field reads. So I just wanted to comment on that, but I really enjoyed your talk. Thank you very much, and I totally think we have to just go molecular because conventional microscopy without that awareness is just not going to get you anywhere with gametocytes.
And I think to comment on that, there's a lot of variation between microscopy readings, and I agree if you would read 1,000 fields, then of course your submicroscopic pool actually goes down a lot. We have this experience with losing gametocytes and also the way you dry the slides to make sure you don't lose them. So that's all taken into account, and these are actually people actively looking for gametocytes. And I think that's also the big difference, that during many clinical trials people look for asexual parasites and record gametocytes along the way. And that's the least sensitive approach you can think of. But this is perhaps not as good as microscopy can be, but it's pretty good microscopy.
Just following on from that question, one thing which microscopy can give you is male versus female gametocytes, and you didn't mention that as being quite a large component here, or I might have missed it. So do you think the next generation of NASBA, as we drill down into this, is being able to discriminate between those two? Because as we heard on Sunday at that meeting, that could be a very important component.
It's actually, in a previous talk you said my work belongs to the old literature, and this is, no, I was going to make a joke that it's outdated. Now we have developed a male-female QRT PCR that is not that easy to do, because the male marker is, PFS25 is very special in the sense it's very abundantly present, it's very stable, you can detect it from filter papers, and the male equivalent, P230P, is actually less abundantly present. So you need to take a larger blood volume, but in the current survey in Burkina Faso that we're doing, we're taking a large volume of blood, we concentrate the gametocytes, and we can look at male-female ratios. I do believe that's indeed one step to go. Quantification is the other step, and I still have the feeling that PFS25, although it's supposed to be completely specific to mature gametocytes, I have the feeling we may be detecting gametocytes that are not yet infectious.
Very nice work and presentation, Teun. What can you tell us about the gametocyte burden and time of blood sampling, not mosquito feed, blood sampling?
The time during the day.
Well, time of the day, yeah.
So the hypothesis would be that a clever parasite would go where mosquitoes can find them in the skin, and would go there at the moment that mosquitoes are around during the night. I do believe there's some indications for them sequestering in the skin, but there's no evidence whatsoever. But I would love to find that evidence. I think the pattern that they would be present in higher concentrations during the night, I find that quite difficult to understand with the half-life of gametocytes. So for some parasites it's been shown, but gametocytes are actually there for quite a few days. So I'm not saying it's impossible. Perhaps I just don't like wild ideas. But I find that difficult to believe at present.
Okay, thanks, Teun. I think we'll move on.